Time is 9:34 now, and dental dread is real for many Americans. In fact, it's estimated anywhere from 9 to 19% of adults avoid going to the dentist because it makes them anxious. But two new tools can make your next trip to the dental chair a little bit easier. Fox Medical Team's Beth Galvin joins us now to talk about those. Beth, good morning.
And good morning, Elise. And your next trip to the dental chair is later today, so I hope you're going to be listening for this. And Michael Thompson, the guy you're about to meet, cannot stand needles at the dentist, but he really can't stand that numb, can't talk feeling when you're done with your dental procedure. So he was willing to brave one extra shot this time around that would reverse that numb feeling twice as quickly. As a consultant, Michael Thompson says he spends about 6 hours of his workday talking on the phone, which is a problem when Thompson needs a crown. And Inman Park Dentistry's Dr. Alex Rodriguez has to numb his mouth, leaving him with that fat-lipped, can't really talk right now feeling for hours.
The last time I was here, I had to have quite a lot of anesthesia, and it took 2 to 3 hours for it to completely wear off. And I really, for the first hour of that, didn't feel comfortable being on the phone at all.
So this time around, Thompson is trying something new, a numbing reversal shot known as Oraverse.
I go back, I give the reversal agent. What that happens is blood vessels start dilating.
For about $25 to $50, which is not covered by insurance, Dr. Rodriguez says Oraverse will make the numbness go away in about half the usual time.
It's not going to make it go away like that, but you might get an extra hour or two without being numb, and that can be really worth it.
And if you hate shots at the dentist, there's a new needle-free nasal numbing spray, too.
It's called Covanase. It's, you know, the number one thing people hate about the dentist is the shot. No one likes it. I get that all the time.
With this spray, there are no sticks.
It's 2 spritzes in the nose.
And that's usually enough to numb the nerves in the top front part of your mouth.
It works on your upper front teeth back to about here. It does not work on the molars, and it will not work on bottom teeth.
Covanase is also not covered by insurance, so it's about $50 to $100 extra. But for some people, it might be worth it to make that next dental visit a little smoother. And about 15 minutes after his Oraverse shot, Michael Thompson says he could feel a little bit of the numbness lifting. He says he was hoping that by the time he got back to his desk, back at work, and back on the phone, the feeling would be completely, hopefully, gone.
Yes, that is so interesting. I think a lot of people are like, ooh, I'd kind of prefer that. Really would. But if you're having a major procedure, it sounds like the numbing shots are still the way to go.
Yeah, and you know, Dr. Rodriguez was saying that the numbing shots are getting so much better. You know, the needles are smaller. They're able to do it so much better. And if you're having a major dental procedure, you probably do need the numbing shots. If you're having a minor one and you can get around it, talk to your dentist and see if maybe they can do it without numbing the area.
Well, speaking of talking to your dentist, it's probably a good idea to maybe ask about these, and if the two new things don't work, then maybe there's something else that could, right?
Definitely. Just see what kind of tools your dentist has available, especially if you've got that dental dread that they talk about. About 10% of Americans just don't even go to the dentist because of their anxiety.
Wow.
So if they can get you in and make it a little bit easier, it might be worth paying a little bit more.
Yeah, and worth the conversation at least.
Yeah,
no
definitely.
Doubt. All right, Beth, thank you.
Thank you,
We appreciate
Elise.
it.